I'm going to start picking this up here. Just a kind of a quick review here as we move through these slides, and we'll finish up the vertebral column today because we did start it last time, I believe, right? We got along pretty okay. So just a couple things that you definitely want to know here. We already know that there's 24 movable vertebral bones in the spine, and we also have a sacrum and coccyx also. All right. So the 5 divisions: cervical, thoracic, lumbar. Cervical is neck. Thoracic is going to be anywhere you have a rib. All right. That's often referred to as the mid or upper back. Lumbar is the low back. Sacral is going to be the bone that's sandwiched in between your hip bones, helps to make up your pelvis, I should say, and your tailbone, coccygeal bone. So when we actually identify vertebrae in these areas here, all right, we use the capital letter for the first letter of that area. So C, T, L, those are the individual vertebrae. S and C, those are all fused, so it doesn't really matter. And then we actually will assign a number. So there's 7 cervical vertebrae, okay? So you have 1 through 7 bones in your neck. So if I'm talking about the last bone in your neck, then I call it C7, all right? If I talk about the first bone in your neck, I'll call it one of 2 things, either C1 or, do you remember the name? The Greek titan that holds the earth up? Atlas, yeah, Atlas. Okay, so C1 is also known as the Atlas. C2 has also got a second name, and that's Axis. Okay, so the last vertebrae in your spine, okay, will be in the lumbar area, and that would be L5, because there's 5 vertebrae in the lumbar spine. So that's how we name it, all right? We'll usually use, well, not usually, we always use the first letter of the region and then the number of which vertebrae we're talking about. So you saw this last time here, and we were talking about the different regions, all right? Keep in mind how many vertebrae are in each region. So cervical has 7, thoracic has 12, and each thoracic vertebrae has a pair of ribs attaching to it, 1 on each side. So how many pairs of ribs do we have?
4. 8.
Keep going. 4, 8, and what's the next multiple of 4?
12.
There you go. All right, perfect. So you have 12 pairs of ribs, okay? Lumbar region, you have 5 vertebrae. Sacral region, it's 1 bone, but at one point they were 5 vertebrae that have fused, okay? And then the coccygeal region is also 1 bone, but at one point it can be anywhere from 3 to 5 vertebrae that fuse together, okay? But for the most part, in us and adults, they're all fused. All right. In some cases you won't, all right, but those are far and few between. So we're talking about the cervical vertebrae. This is going to be, all right, think of your neck. Cervical region is going to be the neck. C1 articulates with, all right, the occipital bone, but specifically the occipital condyles on the occipital bone. All right, and then C7, the last vertebrae in your neck, is going to articulate with T1, or the first thoracic vertebrae. Okay? All right, so let's take a peek here. Here's our 7 cervical vertebrae, all in the neck. So there should be no ribs that attach onto the vertebrae in the neck. Now there is, all right, a congenital anomaly called a cervical rib, and you can see that in some people. The 7th vertebrae, C7, can sometimes have very small ribs coming off of it. Okay, it's kind of weird. You don't see it too often, but you can. Okay. All right. And this is just an X-ray showing you all the different parts. Here's the atlanto-occipital joint. Here's your atlas right here. It sits right beneath the skull here. Here's axis. That's C2. Okay. All right. Thoracic vertebrae. All right. So this is the portion of the spine that is just inferior to your neck. Okay. So for the most part, I was telling you guys that each vertebrae will have 1 pair of ribs. In some instances, you'll have 2 pairs. All right, but not to be confused. And the only reason why I tell you 1 pair in the beginning is because I just want you to remember that there's 12 thoracic vertebrae. All right. For the most part, I won't really get into to the demifacets and all that in regards to the ribs. But usually we associate one pair of ribs per thoracic vertebrae. In some scenarios, you'll have two pairs. Okay. So T1 through T12 are how we number the thoracic vertebrae. And the T12 is going to articulate with L1. All right, that's the first lumbar vertebrae. So when I show you this picture here, you can see the thoracic vertebrae pretty much makes up, all right, your mid or upper back, and it's associated with ribs for the most part. And this is a typical thoracic vertebrae. All right, now you can see it from the anterior view. Here are our thoracic vertebrae. All right, finally, not finally, but the next region is the lumbar vertebrae. This is your low back. Okay, there's 5 lumbar vertebrae. And so the last lumbar vertebrae, L5, is going to articulate, all right, with your sacrum. Okay, now this says the first sacral vertebrae, but it's all fused at that point. So it's just going to be the sacral bone. Okay, so when we show you that here, again, you should not see any ribs attaching onto the lumbar vertebrae. But of course, there's another congenital anomaly in which you can have a lumbar rib. All right, but that's very few, less than I think 1% of the population has a lumbar rib. But you can see here when we're looking at a typical lumbar vertebrae, you can see how big the vertebral body is. Okay, very big, short, kind of stubby spinous process here. You can see it on the X-ray here. Okay, this is actually a decent X-ray. Okay, nice curvature in the back. Discs here. What are the intervertebral discs made of? What kind of cartilage? No, it's the one that's supposed to be compression resistant. There's only 3 places in the body we find it. It doesn't have a perichondrium. There you go, fibrocartilage. That's right. Okay, so you can see on an X-ray we can't see the discs, right, because of the high water content. The X-rays pass right through it. All right, but we can see the spaces where they're supposed to be. Okay. All right. So then the sacrum here again is the last, not the last, but it's where the actual vertebrae will sit on top of this bone. It's a triangular bone. Okay. Normally there's 5 vertebrae that have fused at one point, so they completely are fused by the time we reach our late 20s. But there are some instances in which they don't completely fuse in some individuals. Okay. But this bone here is what articulates with your hip bones, all right, on either side. So it has lateral articulations, all right, with your hip bones. And then it has an inferior articulation with your coccyx, all right, or your tailbone. So you can see it here nicely in this picture, right? You can see here above it, superior to it is the lumbar spine. Lateral to it, you've got your hip bones. And then inferior to it, you barely see it, but there's the coccyx right down here. Right? Coccyx is the tailbone, right? Anywhere from 3 to 5 vertebrae at one point, they've all fused. Okay? There's nothing after the coccyx. That's it. One of the things that folks don't realize about their tailbone is that a lot of ligaments attach onto the tailbone. So that's why people will have lingering pain in their rear end if they've ever fallen and broken their tailbone, because it yanks on those ligaments, and those ligaments travel, all right, not only to the sacrum, but to other regions there, all right, in the pelvis, and they'll have prolonged pain because of that. Okay? Over time, it can fuse to the sacrum. So usually if you're going to dislocate or fracture, all right, the coccyx usually happen earlier in life, all right, at a younger age. All right, we already talked about the spinal curves here, so I won't get into that. We'll skip past that. Here's some more pictures here of the different types of scoliosis curves that you can get. This is more of what we call a C-shaped scoliosis, almost like the letter C. Here you can see it's still a C shape, but the majority of the curve is in the low back. This is the more common C-shaped curvature of a scoliosis, all right, thoracic and lumbar. And then you have your S-shaped scoliosis, which is a double curve. Go over here one side and it swings back the other side and it comes back, all right? So there's different formations for scoliosis. We already labeled all this, I believe, so want to make sure that you have, all right, all of these structures labeled, not just for, this is a thoracic vertebrae, by the way, but you want to, we haven't finished all the labeling, and I'll get into the labeling here, okay? But I want you to make sure that you have at least the transverse process labeled, spinous processes, the vertebral body, the vertebral foramen, okay? And then we didn't talk about what the lamina were, but the lamina are pretty much from the transverse process, all right? They're part of the vertebral arch. You have a lamina on each side, and where they come together and fuse, okay, right through here, that forms the spinous process. So you've heard of the condition spina bifida? Well, that's what happens when both the lamina fail to fuse together to form a spinous process. When that happens, all right, and there's varying degrees to that. In some cases, this whole area could be missing, all right? In some cases, the spinal cord will stay in here in the vertebral foramen, but if it's bad enough, the spinal cord and its contents can spill out. And people that have that type of spina bifida pretty much don't make it very long, okay? Usually right after birth, they're not too long. All right, so let's look at one of our lumbar vertebrae here. So if you want to go to, what page is that? You say 18? Okay. So if we go to 18, I'm going to walk you through all this, okay, real fast. All right, so the first part, the vertebral body is this big fat area right here, okay? And then you've got a structure on either side, on the back side of the vertebral body. By the way, this is the front of the vertebrae, this is the anterior portion, and this is the posterior, or the back side. So between these two blue lines that I'm drawing, here and here, here and here, that's the pedicle. Okay, we didn't label this last time. So the pedicle makes up the lateral boundary to your vertebral foramen. Okay, the vertebral foramen is this hole here in the middle. That's what the spinal cord is. All right, and then the spinal cord gives off what's called the spinal nerve, and that's what leaves your spinal cord, goes out to your body. So the pedicle makes up the floor of that area there. Okay, so we've already seen the transverse processes, all right? Those are these bony processes that come off to the side, all right? And then past the transverse process, pretty much from here, let me erase all that. Here and here, all right, so this whole area, that's a lamina. And here and here is another lamina. And then where they both come together and fuse, this part that I'm shading in, that's the spinous process. Does everybody feel comfortable with how I explain that? You won't hurt my feelings if you didn't understand anything. Okay? The new structure we haven't talked about is the lamina. That's just on this back portion. So you can see here on the vertebral foramen, the posterior part of the vertebral foramen back here, all right, the lamina are back behind that. Okay, kind of that area where I'm shading in. All right, I did discuss with you folks, so are the lamina part? Yes, that's a great question, Casey. That is, yes, the lamina are part of the vertebral arch. The vertebral arch pretty much goes from the back side of the vertebral body, so that would include the pedicles, the lamina, bam. Okay, that blue line is the vertebral arch. So, you guys remember this slide last time? Okay, forget this right now, articular facets. Let's talk about processes. A process is a projection off of a bone, right? Okay. So this is a superior articular process because that is a bone projection coming off of the bone, going up superior wise, so we call it a superior articular process. Okay, this one is going inferiorly, so we call that an inferior articular process. Okay, so I want you to think of an articular process like your hands. Okay, when you put your hands together, right, like when you're going to clap your hands, you bring your hands together. Okay, the part of your hands that are touching one another, right, that surface, which would be the palms of your hands, would be your facets. Okay, so the facet, okay, is going to be the surfaces of the bones, however many bones are articulating with one another. In this case, it's going to be two. It's going to be the surfaces of the bones that are connecting to one another. Okay, so you'll find facets on a process. Facets are flat, all right, and they're smooth, all right. So granted, your whole hand is the process, but the palms of your hands, all right, and those fingers that are actually touching each other, those are going to be the facet surface. All right, that's going to be your joint. So if you rub your hands back and forth, all right, that's going to be the facet. Okay, but now mind you, the front of your hand and the back of your hand make up the process. The side of your hand makes up the process. Okay. If I could draw, it would look like this. Well, I'll use two different colors. So here's a process right here, all right? And then just this part of the process that I'm coloring in with red, because this is the only part of the process that's going to connect to another bone, that's the facet. Okay? So the blue part, that's the process, but the red part is going to be the part that connects to a different bone, and it's a nice smooth surface area, and that's the facet. Okay? So you've got to be careful when you're reading these questions here. All right, and they ask you about facets versus processes. Okay, so on this one here, we added a new title, superior articular process. That's this whole here. Okay, there and there. Okay, superior articular process. We all get why we call it the superior. This is coming off the top of the bone. Okay, it's superior to the bone. So you can see it right there. That whole thing that's circled, that's the superior articular process. So now on this next slide, okay, you can see I've added a new title here, the superior articular facet. So that would be the smooth region of this bone here, kind of like what I'm filling in here with the blue. All right, it's nice and smooth. Okay, it's flat. So that's going to be the part of this vertebrae that's going to articulate with the process of another vertebrae. So facet is a nice, think of it as a flattened surface. Yeah, kind of. You know, a fossa is kind of more like a depression. All right, the facet is going to be just a flattened, smooth area. Remember, our joint surfaces, you want them flat. You want them, well, I shouldn't say you want them flat, but you want them smooth, nice and smooth. You want as little friction as possible. Okay, so that brings me up here to this structure here, the intervertebral foramina. Okay, so the intervertebral foramina are only present when we have the whole spine together. You have to stack several vertebrae on top of one another. And when you do, right, we create these passageways. And those passageways allow for the spinal nerves, those are the nerves that come off the spinal cord, to leave your spine. So I'm going to come back to this slide here, zoom in. All right, so you can see here how we've stacked all these vertebrae on top of one another. And we have these circular passageways here. Those are the intervertebral foramen, and this little green structure here is supposed to be the spinal nerve coming out. So that spinal nerve comes out of the spine. Okay? So I think it was Casey that asked about the vertebral arch, and that's again going to be our two pedicles and the two lamina. And the pedicles are going to be those bony prominences that come off of the posterior lateral portion of the vertebral body. Okay. So well, actually, let me go back to this slide here so you can see the intervertebral discs. All right, so you folks should be able to tell. Here we have our intervertebral discs highlighted. All right, and those are, all right, that fibrocartilage structure that's in between, all right, each of the vertebrae here. Okay. This slide actually might give you a better definition than what I was trying to do when we were talking about the facets. All right, that smooth surface on each of these articular processes here. Keep in mind, the inferior facet of one vertebrae is going to articulate with the superior facet of the next vertebrae. So what does that mean? All right, you got one vertebrae here. Okay, there's its process. It's a horrible drawing, I apologize. And then you got the vertebrae below it that's got a superior process coming off. Kind of color it in there. So this is C4, and this is C5. So what this is saying, the inferior facet of C4 is going to articulate with the superior facet of C5, or the inferior vertebra. You guys see that? Okay. So the inferior facet down here of C4 articulates with the superior facet of C5. Okay, even though C5 is right below that other vertebra there. One of the things that you want to know about the intervertebral discs, all right, besides that it's fibrocartilage, it's a donut. Okay, so the donut has some goo on the inside, like a jelly-filled donut. Okay, and that jelly-filled donut is called the nucleus pulposus. So that's what a disc herniation is. That jelly squirts out of there. Okay, because the outer fibrocartilage area, the annulus fibrosus, it gets a crack in it. And then that nucleus pulposus squirts out of it. Okay? Yes, sir.
So like when you get like injections, is that what you call it? Like back injections for that? For a herniated disc, if they do it wrong, could it paralyze you? Because it's like right on the vertebrae.
Technically, I mean, the chances of them paralyzing you is very, very low because of where they give the injections usually, if it's for the low back. But it depends on what's causing the pain, because it might not necessarily, if it's a disc herniation, obviously, but it could be for something else. But for the disc herniation, they'll manage that, you know, I mean, they will go in and do surgery depending on how bad it is. But what they'll do is they'll try to get the injection as far away from the spinal cord as possible. And we're actually going to talk about that when we do the spinal cord. I'll actually explain to you how they do epidurals and injections. So we'll come and revisit that. Okay. So again, what's the job of the disc? Shock absorbers. Okay. All right. So we've labeled this before. Let's go. All right. This is way better. I should have showed you guys this before instead of trying to draw. Okay, so here you can see L1 and L2. So down here is the L1 inferior, the inferior articulating process, and it's going to actually articulate with the superior articular process of L2. All right, so L1 is up here, L2 is down here. Okay. All right.
The spinous process, which you do in
Yep.
your hands and your back.
You go right down the center of your back, and you're going to feel the spinous process. And that's actually what anesthesiologists will do. They'll palpate out the spinous processes. And there's certain anatomical landmarks where you know which spinous process that you want to do. Because for anybody that's ever had an epidural, usually if they do an epidural below the around L3 and L4. Again, when we get into the spinal cord, your spinal cord eventually terminates, usually at L1 and L2. And then what happens is, normally we're used to seeing the spinal cord as one big, thick rope, all right? But it ends, all right, and it's got a little tip there. And then at that point, you've got all these little kind of strands that hang off of it, okay? And this actually happens at L1 and L2. So when we get down here to L3, 4, we're going to give our injection. We're going to put the needle, and it's usually, if you do it right, you can push it into the spinal canal there, and those little tethers will move out of the way. So you're not actually pushing the needle into the solid part of the spinal cord, okay? So when you go down here to where the spinal cord ends, you do it right. Those little tethers, you do it slow enough, they'll move out of the way so you don't impale the nerves there, and then they can release the medicine into this area. And it'll numb all that. We'll get into that when we do the spinal cord. Okay, we've already talked about that. Here we go. Let's make sure we got all of this labeled here. You guys have all that labeled? Transverse processes, transverse foramen, and the lateral masses and all that? Okay, so a couple notes on the wait, did I do atlas? Oh, here it is, atlas. Okay. All right. I talked about this last class. All right. This joint between the skull and the first vertebrae, all right, allows you to do the nodding yes. So that's flexion extension. Okay, and that has to do with the atlanto-occipital joint. Then when we get down here into the axis, all right, that's between the C1 and C2, all right, the dens, you can call it the dens or the odontoid process, but it's the joint between those two vertebrae, the atlantoaxial joint, which it's a pivot motion, and that gives us the no. So rotation of your head from side to side, 90% of that movement occurs at that joint. Okay, so here you can see, here's your axis. All right, you can see how the dens, all right, moves up into the atlas here. So you should have all this labeled on your notes there. All right, don't forget the bifid spinous process. All right, if the spinous process has these two little nubbins, one here, one over here, you can call it a bifurcated spinous process, or you can call it a bifid spinous process, either or. All right, so your laminas are back here. Okay, you have your dens, you have your superior articular facet. Now you see how this arrow is pointing, all right, to the flattened portion here. That's the facet. All right, then you got the pedicle here and here. Then you got your vertebral body, which the dens sits on top of, and our vertebral foramen. All that should be highlighted. And then you can see part of the inferior articular process down here. Here's your other inferior articular process over here. All right, something you should know about C7, if you run your hands down your neck and you feel a bone at the bottom of your neck, that's C7, all right? And that's the spinous process of C7. So we refer to that as the Vertebra Prominens. Just in case you want to know, it's another anatomical landmark that you can use, okay, in order to differentiate, all right, the end of the cervical vertebra or region where your neck ends and where your mid-back begins of the thoracic area. Okay, so this one has the longest spinous process out of any of the cervical vertebra there. Okay, so one thing that you want to know as you transition, okay, from one region of the spine into the next. All right, so as we go from the cervical area into the thoracic region, all right, as we get closer to the next region, those vertebra, all right, in the current region that you're in, so if we're in the cervical region, C6 and C7, they start to take on the characteristics of the thoracic vertebra, all right? So their spinous processes start to get longer. So when we're in the thoracic spine, All right, we start to get like T11 and T12. The vertebral bodies of those thoracic vertebrae start to get bigger. So it's a gradual kind of transformation or transition. All right, so the inferior vertebra in whatever region that we're talking about will start to take on the characteristics of the region below them. So like C5, C6, C7 will start to take on more thoracic vertebra characteristics. T10, T11, T12 start to take on lumbar characteristics as we start to transition from one region of the spine into the next. So here you can see, here's our thoracic C7, but the spinous process is starting to get elongated here because the spinous processes in the thoracic spine are much longer. So here you can see, all right, your thoracic vertebra here. All right, make sure that you got all these labeled. Did I say thoracic? My bad. Sorry. I was going to say, no. All right. I saw the transverse foramen there. I was like, these aren't thoracic. All right, this is a typical cervical vertebra here, okay? Now, this does say it's a bifid spinous process, and that's true because part of this spinous process is busted off. Okay.
Looks like a smiling cat.
All right, so keep that in mind. Now, again, you look at this, the superior articular facet is just referring to this smooth surface here. All right, you guys have all that labeled? I hope so. All right, now what I'm going to do is I'm going to show you the lateral view of this. Okay. See, this part up here does a really good job of showing you what I mean by the facet and the process. Okay, this arrow here is pointing to the whole process, and then this arrow here is pointing to the flat surface on top of that process. All right. Quickly about the thoracic vertebrae. We have 12. They each are going to articulate with ribs. Okay. You don't need to know the costal facets or the demifacets for identification purposes. But again, these are just areas on these vertebrae in which the ribs and the rib heads will attach to the vertebrae there. Okay. And you'll find these on the vertebral bodies, and you'll also find them on the transverse processes. Because in some situations, a rib can attach twice to a vertebrae there. Okay. Okay. So let's take a peek. You should have all this. And again, all right, the structures that are in the purple or blue here, you do not need to know for identification purposes, but sometimes it's just nice to know. Okay. So all of that should be labeled. And you can see on the lateral view here, you can see how long the spinous process is for the thoracic vertebrae. It's nice and long. So this shows you, all right, the costal facet. So the rib head will attach here on this vertebrae. And then it doesn't attach, all right, until a second time over here on this costal facet on the transverse process. And I'll show you when we look at the ribs, okay, one rib will attach twice. Okay, there's two areas in which it will attach onto a vertebrae. All right, does everybody have that labeled? You're good with everything? Okay. Lumbar vertebrae, down here. Big thing that you want to know. All right. Much thicker and a larger body. Okay. So there's no ribs that attach on the lumbar vertebrae. Therefore, there are no costal facets. Okay. And obviously, we already knew that they don't have a transverse foramen. All right. So we have large vertebral bodies on these vertebrae because they're bearing pretty much the weight of the upper half of your body, okay? So when we take a look at it, you can see this huge size of the vertebral body here. All right, but you should have all of these structures labeled here. All right, and then we'll go to the lateral view here. This is a great picture of an inferior articular process. But you notice here, when you look at the spinous process, it's short and stubby compared to the thoracic. So this is, you should definitely be able to, I'm telling you this right now, you'll probably have anywhere between 2 to 4 questions, which are going to be 2-part questions. And one part of those questions is going to ask you, what region of the spine is this vertebrae found in? Okay, it'll ask you the spinous process. Okay, it'll have an arrow pointing in the spinous process. It'll want you to name that, and then it'll want you to name what region of the spine this vertebra is from. Okay, so you need to be very familiar. All right, I don't want you to lose points on that. People have a tendency to lose points, and I was grading lab tests, and people still. I noticed. I don't think it was in this section so much. Didn't read the words on some of those test questions, and it asked for it was sebaceous gland. And it said, where would you find what region? Where would you find this? And people labeled it sebaceous gland. My point being is just quickly. It'll take you 2 seconds. Look to see if there's any words on the slide. Okay. If there is, read them. Make sure that you know what the question is, what it's asking you for. All right. Let's jump into the sacrum here. We're almost done, okay? Sacrum is going to be that triangular bone at the base of your spine, okay? It is going to make up what we call the posterior wall of the pelvic cavity. That's that space. Remember the pelvic cavity where we found the urinary bladder, some of our reproductive organs? You had the abdominal pelvic cavity, and then you broke down the abdominal pelvic cavity into the abdominal cavity and then the pelvic cavity. All right, well, this makes up the posterior wall of the pelvic cavity. Okay, so the very tip of the sacrum is going to be the apex, and then the broad-based region is going to be the base. Okay, so we're going to see, all right, a more pronounced curvature in men. All right, so let's take a peek here at the sacrum. I think you've seen this is the lateral view here, or posterior lateral view, and the anterior view here, okay? So if you've noticed, you've got, all right, at one point, we saw these ridges here. These guys right here, and these are remnants, all right, of where, all right, these vertebrae, where they used to be separate, where they fused together. And in some cases, these used to be discs, and they went away, all right? Well, in some cases, their discs don't disintegrate and go away, so they'll have what's called a rudimentary disc, and it'll remain there, right? That's what these transverse ridges are, or the transverse lines, okay? That's where we see the fusing of those separate vertebrae. So there are 5 individual vertebrae, they've all fused together, okay? And the top part of the sacrum, where the base is going to articulate with L5. And your sacrum is going to have its very own superior articulating process. And I'll show you a picture here of it. Okay? Here it is on the back side of the sacrum. And that's going to articulate with the inferior articular process of L5. And you're going to have a disc right here that sits on top. And that's referred to as the L5 S1 disc. That is the most commonly herniated disc in the body, okay? Because that is the last disc. That disc pretty much has to bear all the weight. And just because of the mechanics and the architecture of your spine, it just takes quite a beating. So most people will herniate that disc, and then the next disc that gets herniated commonly is the L4, L5 disc. So we just work our way up the lumbar spine when we are talking about the frequency of disc herniations. No, they're not a joint. Sutures are actual joints, and they can eventually fuse all the way together, but they're not a joint at all. No. All right. You don't need to know this for identification purposes, so we'll skip over that. But you do need to know on the sacrum here, the sacral foramina. Now, I won't mark you wrong if you were to write anterior or posterior sacral foramina, or if you don't even write that, okay? But technically, if you're looking at the front of the sacrum, that's the anterior sacral foramina. If you're looking at it from the back side, that's the posterior sacral foramina, right? Obviously, this is where you're going to get nerves that are coming off of the spinal cord or exiting, all right, those regions there, okay? We saw this before, the ala here, that's the lateral surface of the sacrum. We'll see that here in a second. And then we have what's known as our auricular surface. That's going to be the lateral portion of the sacrum that's going to articulate with your hip bones or your os coxa. Okay, and then they're going to make up the pelvis or the pelvic girdle. Commonly, that joint is referred to as the sacroiliac joint. It's one of the strongest joints in the body. All right, it's one of my favorite joints. So let me show you a picture. Okay, so here you can see, all right, we're looking at the front of the sacrum. So these are the anterior sacral foramina, and then you've got your sacral ala or ala, these guys right here, here, and here. Okay, and we can't see it here on this view, but then we've got the auricular surface. This is the side view here, and it's just going to be this part of the sacrum, and this part of the sacrum is going to directly articulate with your hip bone to make the sacroiliac joint. All right, and then finally the last part of the vertebral column, here's the coccyx. All right, this actually again is a fused bone. Okay, it can be anywhere from 3 to 5 different vertebrae. Okay, usually it's completely fused around age 25. Several ligaments and muscles will attach to this area, right? So that's why people have pains in different parts of their rear end, and part of their history, they'll say, I fell when I was roller skating when I was 12, or skateboarding or whatever, all right? And then you take an x-ray, and here's their sacral bone, okay? And then their coccyx is like this, right? When it should normally be like this. So they pushed it in, and that yanks on all those muscles and all those ligaments there, and it disrupts proper biomechanics. So here you can see, here's your coccyx, right here at the bottom. You can see where it used to be individualized, and then it's all fused together. And eventually this whole thing will fuse. Right? Disc herniations. I briefly talked about this. Okay, that's that jelly donut. All right, and then our center of our jelly donut, all right, we've got our nucleus pulposus, so NP, okay? And then we've got our fibrocartilage, and it's got all these rings that goes around and around and around. And eventually you get these cracks in the rings, and the nucleus pulposus just spills out. When it spills out, it's going to push on stuff. So what's behind the disc, right? If everything pushes backwards, you've got your spinal cord back there. Well, your spinal cord, all right, gives off the spinal nerves. So depending on where that herniation is, if the herniation comes out and it pushes on the spinal cord, it can cause pain or numbness. But sometimes it can push out and push right on the spinal nerve. Okay, so it depends on, the symptoms are going to depend on where that disc herniation is pressing on the spinal cord or the spinal nerve. Okay, but we'll see it in 2 regions. Okay, in the cervical spine and in the lumbar spine. That's where you're going to see disc herniations. And it's easy to tell. All right, if people have pain in the leg, okay, most likely it was a lumbar herniation. If they've got a pain in the neck and the arms, all right, it's a cervical herniation. Okay, so we've all heard of sciatica. Sciatica is the sciatic nerve, right? And so the sciatic nerve distributes pain down along the back of your leg, all the way down to your foot. You don't have sciatica if you get a pain that goes down the back of your leg and stops at your knee. It's not sciatica. It has to go all the way down to your foot. Okay, and even then it might not be sciatica. So it has to go down the entire lower limb. Okay, and you also get localized pain in the back here. Also for cervical disc herniations, you get neck pain, and then you'll get pain in the upper limb. All right. It's very rare, by the way, to get a thoracic disc herniation. Does anyone know why? Yeah, your ribs. Your ribs will block a lot of excessive movement there. Okay. Speaking of ribs, there's a thoracic cage. Let's talk about the thoracic cage. Okay. So this is the last part here. All right. So we're dealing with the thoracic cage. All right. We're going to be dealing with, all right, a couple different parts: the front, the back, and the sides. Okay. So in the back, you've got your vertebral column. Okay. So the thoracic vertebrae are going to make up the posterior border of your thoracic cage. And then you've got the ribs that are going on the side here. All right. So they'll be on the lateral portion. And then you got your sternum or your breastbone on the front. All right. And that's going to be the anterior border of the thoracic cage. Okay. And its job, all right, is obvious. It's got a couple jobs. All right. One is to protect, but also is to provide structures for muscles and other things to attach onto. Okay. So a big function thoracic cage is protection. Okay. Another function is an attachment site for muscles. Okay. Keep that in mind when we're talking about the thoracic cage. Okay. So let's start off with your breastbone, your sternum. Okay. It's a flat bone. This bone is highly responsible for the process of hemopoiesis. That's the process of making blood cell elements, red blood cells, white blood cells, platelets. Okay, your sternum plays a huge role in that, as do your ribs, as do your vertebrae. Okay, so this makes the anterior front portion of the thoracic cage. And there's three parts to it. The very top part, this bone is shaped kind of like a wedge. Okay, that's the manubrium. All right, I drew that horribly, by the way. Kind of like this. So you've got a notch in the middle of it on the top portion. That's called the jugular notch or the suprasternal notch. Something that you need to know. Okay. All right. So that top bone, there's three bones. Look, there's three bones that eventually fuse, but there's three bones to the sternum. The top one, all right, is the manubrium. The middle one, the longest one, is the body or the sternal body. Okay, this is where you're going to see ribs attaching to. Okay, ribs one attaches onto the manubrium. Well, it actually attaches in between the manubrium and the sternal body. All right, we'll see that here in a second. But for this one here, for the sternal body, ribs 2 through 7 will attach onto here. Okay, on the lateral portion, specifically the costal cartilages for those ribs. All right. So if this is your manubrium here, the sternal body kind of dips down here. Okay. And where they attach to, that's referred to as the sternal angle, that line there. Okay, and that's where your first rib will attach onto. All right. And the last part is this. That's an awful drawing. I apologize. I'll just show you the picture here. Is the xiphoid process. Okay. And this is the tip of the sternum. All right. It ossifies later on in life. So let me show you a picture. My drawings are awful. I apologize that you folks have to put up with that. Okay. So here are the three parts of your sternum. All right. The manubrium, this top portion here. Here's the body. And here's the xiphoid process. And you can see all this is representing the costal cartilages, all right, that attach the ribs. Ribs 1 through 7 will directly attach onto your sternum. Okay. We call those true ribs. All right. We'll get into that in a second. Now let's throw the whole thoracic cage up here. Bam. Now you can see things a lot better, okay? You can see here's where the clavicle or your collarbone, it attaches on the manubrium. And then in between the two collarbones, all right, we have our sternal notch or our jugular notch. Then there's the manubrium, here's the sternal body, and here's the xiphoid process. All right, quickly let's wrap up with the ribs, and then I'll throw up the remaining slides here. Make sure you have everything labeled. Okay, ribs are going to be, they're not long bones, they're flat bones. Okay, we'll talk about what long bones, short bones are, all that other stuff when we get into chapter 7. So they're going here. It's very important that you know this. They start on, ooh, that was scary. They start on the thoracic vertebrae, all right, on the spine. They originate on the spine, and then they go from the posterior part of the spine, and they wrap around the side and go towards the front. So that means they end, all right, onto the anterior wall of the thorax there. So keep that in mind. They originate in the back, and then they end or terminate in the front. Okay, 12 pairs of ribs. Okay, so our first 7 pair are ribs 1 through 7. We call those true ribs. And I'm going to tell you this, guys, right now. Some of you, because again, all these lab tests are a randomized pool of questions, so some of you might get these questions, some of you might not, but you need to know both names. True ribs, and you need to know vertebral sternal ribs. Okay? But think about it. Dissect the word. For those of you that are taking med term, this will definitely help you. All right, vertebral means all the ribs originate on the spine. Okay, but this tells you that these ribs will directly attach onto the sternum, or their cartilage will, I should say. Okay, so you need to know that. All right, so the ribs will attach onto the costal cartilage, and then the costal cartilage is going to attach directly to the sternum. Okay. So it's ribs 1 through 7. Those are your true ribs, or your vertebral sternal ribs. All right, so let me just show you here a picture real fast. So here's rib, all right, 1, 2, 3, 4, 5, 6, and 7. All right, they're going to directly attach onto, their costal cartilages will directly attach onto, okay, sternum here. So it's tough to tell. That's why I always got to do this. Oh no, don't do that. What I do? I'm going to give a dividing line here. Okay, so this is rib 7, and its costal cartilage attaches directly onto the sternum. You see that? Okay. So this is rib 8 down here, and 9 and 10, and those costal cartilages do not, they all directly attach onto this costal cartilage and up to here. Okay, so they do not directly attach onto the sternum. So those are our false ribs. Okay, so ribs 8 through 12 are false ribs. Okay, so those costal cartilages do not attach directly to the sternum. And there's 2 types now. Okay, but again, you can read, all right, and understand the types. So when we talk about false ribs, there's 2 categories. 8 through 10 are what we call vertebrochondral ribs. Well, again, they originate on the thoracic vertebra there, but chondro stands for what? Remember tissues? Cartilage. Cartilage. Remember chondrocytes? Okay? Chondrocytes were the cell for cartilage. So these ribs, vertebrochondral ribs, it originates on the vertebra, and then it attaches onto the costal cartilage. Okay? Specifically the costal cartilage of rib 7. Okay, so they don't directly attach onto the sternum, they indirectly attach to the sternum. Then the last 2 ribs, we nickname the floating ribs. Those are 11 and 12. Okay, and we refer to them just as the vertebral ribs because they don't attach to anything. Okay, they're on the road to nowhere. Okay, they go nowhere. So I'll show you all these pictures real fast. Okay, so here you can see 11 and 12. They come off of the vertebrae, but they attach onto nothing. Okay, 8, 9, and 10, all right, their costal cartilage attaches onto 7's costal cartilage. So we call those vertebral chondral. So going back to this one right here, okay, you can see here's 11 and 12. They have no cartilage, all right, but 10, 9, and 8, all their cartilage attaches directly onto rib 7's costal cartilage. All right, a couple parts of the rib, and then I'll quickly put up the other slides. Okay. You need to know that a rib has two ends, okay? It's going to have what's referred to as the vertebral end, and that's going to be the part of the rib that attaches onto the spine, and the part of the rib that directly attaches onto the vertebral body is the head of the rib, okay? And then just at the head is the rounded portion of the rib, and then it kind of slims down, and where it starts to narrow down, that is the neck. And then we're going to see there's going to be a bump on the rib, okay? And I'll show you, I can't draw it very well. But that's going to be the rib tubercle, or the costal tubercle. Right? And then as the rib starts to bend around on the lateral portion of it, we call that the angle. And on the underside of the rib, on the bottom portion, the inferior portion of the rib here, there's a groove there, right? And that's where our blood vessels and nerves sit in there. So we call that the costal groove. You need to know that, where the nerves and the blood vessels will travel. And that's important that you know that, because if you ever have to deal with a situation in which you have to deal with a pneumothorax, does anyone know what that is? What is it?
Pneumothorax is air in the thorax.
Right. It's when and then essentially the lung collapses. And if you have to insert a needle into the thoracic, all right, cavity there, specifically into the pleural cavity to reinflate the rib, you don't want to stick the needle on the underside of the rib. Because if you do, you can hit these structures here. You always want to go, all right, on the superior part of the rib, the top part of the rib, okay? Because you're not going to have nerves and blood vessels on that part. I'll show you a much better picture here. So this is where we have that groove there. You can see it here. There's the groove right in there. And that's where your blood vessels and whatnot. So we don't want to put the needle here. It's too close. We'll put the needle up here because there's nothing up at the top. All right. So here's the head. Okay. And then where it starts to narrow down is the neck. Then you got a bump here. That's the costal or rib tubercle. All right. And then where it curves around, you don't need to know this for the lab test for identification, but that's the angle. You do need to know that where the head and the neck and the rib tubercle are, that's known as the vertebral end. This will be asked you on the question. I've seen it. And then this flat end here is referred to as the sternal end. Okay, because that's going to articulate with the sternum. All right, and if you don't believe me, I'm going to show you this awesome picture here. So you can see how the rib, here's the vertebral, all right, the vertebrae right here, all right, and here's the rib. So the part of the rib that attaches onto the vertebrae, that's going to be the vertebral end. And then this end over here is the sternal end. And you can see the head attaches onto the body, the neck attaches onto nothing. There's a little gap here. And the tubercle will attach onto the transverse process here. Some ribs attach onto one vertebrae directly, and some attach onto two. All right, let me just pop up these other slides to make sure you guys got everything. I know your brains are full. do this real fast. Okay. There's the manubrium. Okay. And you can see it here. I don't know what page that's on, but okay, 20. Okay, and then you can see right here on this next one, there's your jugular notch. There's a couple different names: sternal notch, suprasternal notch. Okay, that little space right here, that little dip down, like that. You can see it on this one here a little bit better. Okay, so there's 3 parts of the sternum. First part's the manubrium. The second part is the body. It's that long part right here. From here all the way down to here. That's the sternal body. Okay, here it is in the thoracic cage. And I'm going to correct myself here. I did say that here at the sternal angle is where rib 1 attaches. I meant to say that's where rib 2 attaches, because that's a very important thing. Because when you guys start to learn, for any of you that are going to be doing physicals and listening to the heart, all right, when you listen to the aortic and pulmonic valves, you're going to listen at this area on either side of the sternum. Right, you palpate out where the rib 2 is. Right, and you'll actually auscultate here. Auscultate means listen. You'll auscultate by the rib space on either side of the sternum. Aortic is over here. Pulmonic is over here. You'll get to learn all those valves next semester. Xiphoid. There we go. That's this little guy right here below, right here. Xiphoid process. And here it is, right there. Finally, the rib. Okay. So this flattened area, okay, this end of the rib is the sternal end. Okay. That's going to be the part that's going to articulate with the costal cartilage, which will eventually attach onto the sternum. All right, depending on what rib you are. Okay, the other end is the vertebral end. So that's why it's very important too, because test question can ask you, and it can be pointing right here to the head of the rib, but it could say to you, which end of the rib is this, or what area of the rib is this? And it's going to happen. People are going to answer costal head or rib head when it wants to know if it's the vertebral end. So just don't be fooled, okay? I don't want you to lose points on that. All right. Now, specifically, that specific area, this right here, that's the rib head. Okay. Then when the rib starts to narrow down, that's the neck. All right, and then you get another bump on the rib, and that's the rib or the costal tubercle. Okay, ribs 1 through 7 are your true ribs or your vertebral sternal ribs, because they all directly attach, their costal cartilage attached directly onto the sternum. Then the remaining ribs 8 through 12 are false. There's 2 types of false ribs. 8 through 10, all right, are going to be the vertebral condyle. Their costal cartilage attaches onto the costal cartilage of rib 7. And then our last 2 are the floating ribs, 11 and 12. And they don't attach onto anything. So all this should be labeled like that. And if you have that, then you're done. Okay. Got done 12 minutes early, not bad. Please, please, please make sure that you sign the attendance. If you can, please sign in next to your name where you sign in for lecture. This makes it easier for me. All right, we're right on schedule, y'all. Now if I could just get my act together for my other section. Any questions from you at home if you're still there paying attention.